Point of care testing is pathology testing performed at the bedside or near the patient and provides results within minutes rather than a few hours to get information back for the clinicians.
Back in 2015, Dr. Bruce Cartwright approached New South Wales Health Pathology with a proposal to trial the use of point of care testing equipment in cardiac surgery.
The challenge in cardiac surgery is that patients bleed, and you don't know whether it's because there's a lack of proline, so there's a lack of sutures in the patient, or whether it's because the patient's coagulopathic. And all you get in front of you is that the patient's bleeding. Cardiac surgery in particular, there's a lot of places that are around the back of the heart or around the back of the aorta. It's not immediately obvious where the bleeding's coming from. These tests sort of give us an ability to work out whether there's a coagulopathy or is a problem with the patient's clotting, or there must be something that's needs to be sutured or tied off somewhere. Blood is a precious resource, and so we don't want to be using it unless we really have to.
We set out to establish a few things. Obviously, getting results sent into a patient's medical record is important and quite difficult, and changes depending on the technology we're introducing.
They were still very operator dependent, so it was hard for us to use it much outside of the operating room because we needed a skill set in the people who were doing the tests that was beyond what we could roll out to the general staff.
It's really important for us to provide as much help as we can to the doctors and nurses and other technical experts using the devices so they feel comfortable to get the right result all the time.
They automated the technology and made it a bit more cartridge based, so everyone could sort of almost do it. Didn't take that technical know-how to do the test. And the director of pathology here said, well, why don't you consider doing this on a statewide basis? And that's how we got in contact with New South Wales Health Pathology.
Our advances in delivering results electronically to people's medical records means that the doctors and nurses don't need to be where the testing's performed. This means that they can be looking after other patients in nearby locations, but still able to help make a decision for that patient's care.
There was clear evidence from around the world that this was a suitable thing to do and led to improvement in clinical outcomes. And that's kind of why we're here, really.
But demonstrating that we can provide value-adding services to the LHDs, and in partnership we can improve patient journeys. Along the way, there's other benefits such as saving on blood product usage and also saving on retransfusions of patients. So we feel that the pilot has demonstrated its worth and the value to the whole of the New South Wales health community.
Patients return to theatre less, and returning to theatre for bleeding or taking back for bleeding is associated with a lot of comorbid outcomes. Patients seem to graduate out of intensive care faster, so complications of surgery are less. Survival rates are better. They get out of hospital earlier.